Hi guys, it's Nachole from Renursing EDU, and today we're going to talk about clinical tips to help you get through your actual clinicals. So when I started clinicals in NP school, I didn't have anybody to tell me what I needed to do and how to prepare. Just having a plan before you go in will actually help you make clinicals smoother. It'll help with your transition into clinical practice. It'll help you gain more insights from your actual practice while you're in clinicals. So I am actually reading today from one of my books. So this is NP School and Beyond, Tips for the Student Nurse Practitioner. And within here, I have a lot of information for nurse practitioner students and people who are thinking about becoming nurse practitioners, and also for the brand new grad. But I'm just gonna go through some of my clinical pearls here and share them with you. Okay, so we both know that clinicals is completely different than didactic in how you study for it and how you prepare. So one of my biggest tips is, depending on what school you're going to need to find clinical placement on your own. So I would suggest doing that as soon as you can. Not only as soon as you get into school, but maybe while you're even thinking about going to nurse practitioner school. Maybe start putting out some feelers and talking to the physicians you work with, other nurse practitioners you work with, anything like that. Other people who have actually gone through school and have just graduated, ask them if they know of anybody that can become a preceptor for you, because I know that's a big hassle for a lot of people when they're in NP school, and it's very, very stressful trying to find a preceptor at the last minute. So if you need something for your clinical day, like a badge, if you're going to be going to an institution, make sure you get that stuff done super early. You don't want to have any hangups, because if you don't get your badge or your parking permit or whatever, you can either be late for clinical or completely miss days. So just get all that stuff done ahead of time if you need. Make sure you're showing up at least 15 minutes early. Do not show up directly at 8 o'clock a.m. or 9 o'clock a.m. whenever you're supposed to be there. Make sure you are there early, because it sets a precedence. Because if you come in on time, even though you're on time, it may look bad to other people, because if you're there on time, you don't have time to take a quick tour of the clinic. You don't have time to kind of small talk with your preceptor. You don't have time to do any of that. So if you can, try to get to your clinical site about 15 minutes early. Wear comfortable shoes. Ladies, I am talking to you. You do not know how long those halls are and how long you're going to have to be standing on your feet. As a student, you may not have an option to sit, and I hate to say that. Many places don't have extra seats. So make sure you wear comfortable shoes. Bring your lunch and some snacks, because you don't know if you're going to be able to actually have a lunch break, let alone be able to go somewhere, or if there is someplace close for you to go to actually get food. So make sure you put something in your pocket, something in your bag, so you'll have enough energy for the rest of the day. Prep your NP bag the day before. Obviously, you want to make sure you have your stethoscope, your otoscope, all your clinical tools, all your resources. If you need to carry around a book or a cheat sheet or whatever it is, make sure you have your bag packed the night before. I have products on Renursing EDU that you can actually use to put in your clinical bag, like the NP H&P and the NP Clinical Cheat Sheet, also some of my books. Here's the cheat sheet. Actually, this is what it looks like. It's only available on Renursing EDU. I don't have these available on Amazon yet, so make sure you get one. That'd be great to put in your binder. Use word of mouth with your nursing network to find preceptors, like I said earlier, including the local NP associations. So depending on where you live, you might have some monthly meetings. And now, since we're in the age of COVID, they may be virtual right now, but you can still kind of network and connect with people in your local area and see if they have any referrals for preceptors or even jobs after you graduate. Same thing, ask your classmates. Your classmates are really good, so everyone goes to a different clinical site. Maybe ask one of your best friends that you study with what clinical site they're at, and if that person is actually taking any more clinical students. Okay, so try to do clinicals at least 2 days a week. The reason being is that if you're only doing clinicals 1 day a week, you may forget from week to week, and then when you get there the next week and you have to kind of relearn and retrain, it kind of defeats the purpose. It wastes time. So if you're doing at least 2 days per week, that way it'll be fresh on your mind and you're not going to have to stop and retrain and relearn things. The next one is prepare for your clinical rotation by reading up on the most common conditions, most common medications and dosages for the population that you're seeing. So for instance, if you're going to be going into a pediatric clinic, you need to be studying on pediatric issues and studying the pediatric dosages and medications. Same thing if you're going into women's health. Just make sure you're tailoring your studies to what you're going to be doing in clinicals. Make sure before you go to clinicals that you've already downloaded all the apps in your phone that could be useful, like CDC guidelines, Hippocrates, Medscape, UpToDate, whatever it is that you feel is useful for you. Make sure you have them all downloaded on your phone. And if you're working at a site that does not have good Wi-Fi, see if you can download those apps directly to your phone so you don't need Wi-Fi to open them. When you are with your preceptor and your preceptor asks you a question, or even a patient that you're seeing ask you a question, I do not know is not an acceptable answer on its own, okay? Make sure if you don't know something, you say, I don't know, but I will find out. That's a big pet peeve as someone who used to precept, and I ask a student a question, they don't know, and they don't follow up with, I'll find out. It makes me kind of feel like they're really unmotivated and they're not really into even wanting to be there. So make sure you follow that up with, I don't know, I'll find out, for patients and for your preceptor when they ask you a question. Because any good preceptor is going to ask you questions. I'm not saying they're going to pimp you, but they're going to ask you questions to see where your mind is, to see what your thought processes are on how to assess, diagnose, and prescribe, and everything else that goes along with being a nurse practitioner. Keep a notebook handy to take notes, so you can take notes from every one of your preceptors. So every one of your preceptors has their own way of doing things and they have different knowledge bases and everything, but from each one you can learn something. So just take a blank notebook, or make sure you have plenty of note space in your notebook that you have, and write down little clinical pearls that they tell you, like, you know, whatever it is. So you may see a patient with a certain condition and they tell you one of the hallmark signs of that condition. Write it down. Ask your preceptor if you can take home a blank copy of the chart if they still use paper. It's weird because 2021, I don't know of many providers that are still using paper, but some may. And when I was in school, I went to clinicals. Some of my preceptors had paper charting. So if they still have paper charting, ask if you can get a copy of just a blank chart, so that way you can kind of look at it to see how they chart, and, you know, so that way you'll be prepared. Keep your own personal example of a soap note handy. This will go in your NP bag and some of your resources for reference. So charting is very important. You want to make sure you're doing it correctly. So if you don't have it memorized yet, just go ahead and make sure you have something that's going to be a good reference for you. So like on my NP clinical cheat sheet, I actually do have like a little section here on soap notes. But if you don't need that, you've got your own, make sure you have it so that way you're charting correctly, okay? Okay, if they do have a EMR, ask if you can actually have access so you can chart. And I know this has been a pain point for some students, especially when I was in school. A lot of people weren't able to get logins, their own logins, to do the electric charting. And it just kind of depends on your clinical site and your preceptor to see if they can give you a temporary login. But I would ask if you are in a position where they're doing electronic charting. Okay, another thing to ask your preceptor is to ask them for copies of resources that they use in clinical practice on a daily basis. Like if you were at a clinical site and they did DOT exams, maybe they have a DOT cheat sheet that would help you, because DOTs are very detailed. And now you have to be credentialed to do it. But back in the day when I was in clinicals, you didn't have to be credentialed, and one of my preceptors gave me a cheat sheet of things you look for and things that would be an absolute pass, or sorry, an absolute fail, or, something that you need to look further into. Another one here is be nice to the front office. These people are grading you too, indirectly, so don't be mean to the receptionist because she's going to go back and tell your preceptor. Ask your preceptor as many questions as you can. You are there to learn. Learn how to competently perform a H&P before your first clinical day. So that's super important too. Charting and actually learning how to perform a correct H&P. And I have that as well. NP H&P is a notebook that I have that will help nurse practitioners make and document a better H&P, and it's very detailed and thorough, but it's very compact, and you can take it to your clinical site and you can put it in your pocket, and it holds up to 100 patient templates at a time. Which brings me to my next point. Keep up on your clinical tracking log. So if you use Typhon or whatever else your school does, make sure you're logging your clinical hours in pretty much every day you're going to clinicals. It just makes things a whole lot easier, so you're not doing things at the last minute and you don't remember everything. But if you have the notebook like I have, then it'll be very easy because you can go through and it has the dates and you can see the clinical site and you can just add it into your clinical tracking system. Okay, so after your clinical day, make sure you read and research about any interesting case that you had that day. Or better yet, just read and research about all the cases you had that day, just to kind of have a generalized overview, even if it was a bread and butter case, like a upper respiratory infection or whatever, to see how your preceptor treated it or how you treated it or how you could do something differently next time. Don't just shadow your preceptors. Jump in and see patients when you can, and don't be scared. Well, I understand you're scared because it's all new for you, but you're going to have to see patients. You're going to have to be alone one day. So don't just shadow your preceptors. You're not going to learn much by shadowing somebody. And lastly, this is back to the networking, is asking your preceptors if they know of any other people that can precept, or if they potentially know of anybody who is hiring if it's towards the end of your clinical rotations in the end of school, so that way you can network and potentially get it in on another clinical rotation or another job. So those were my tips for clinicals while you're in nurse practitioner school. Let me know if you have any comments or questions. Please take a look at everything that we have available on renursing.edu for you, and join our Facebook groups. Look at our resources, and I will see you next time. Thank you.